Welcome to More Context. Today, I discuss the assassination of a health insurance CEO, and more importantly, how the American health insurance system is rigged to generate profits for insurance companies and misery for the rest of us. This assassination has led to so many sharing horror stories of their experiences with health insurance companies. Stories I cannot possibly make it through this video if I repeat. Some even say the assassination was justified. Here is Luigi Mangione being brought into New York, escorted by the mayor of New York, who thought this was a good photo op, when the mayor should also have been wearing orange as he awaits his own trial. Luigi, the alleged shooter, has been charged with murder 1 in New York, along with terrorism. Additionally, he is facing federal charges, which some say may be an attempt to get the death penalty. Clearly, they are trying to throw the book at him, which is strange for one murder, and it may backfire. Terrorism is an interesting choice in New York because they will have to establish his intent not just to murder, but in New York, a person is guilty of a crime of terrorism when, with the intent to intimidate or coerce a civilian population, influence the policy of a unit of government by intimidation or coercion, or affect the conduct of a unit of government by murder, assassination, or kidnapping. He or she commits the specified offense. So Luigi and his lawyers will get to defend not just his actions, or if he intended to murder the CEO, but what his intent with regards to influencing policy was, which is a discussion I don't think they actually want to have. If we want to talk about terrorism, what about the person he killed? He had the blood of thousands on his hands, and he used the profits from those he denied the coverage of to buy off politicians to keep a system going that allows tens of thousands of Americans to die unnecessarily every year. So the CEO killed people for direct political purposes, and the only reason we aren't talking about him as a terrorist is because for some reason denying coverage to paying customers to pad out your own profit margin isn't considered murder. And I'm not talking about triage. They had the money and the resources. They denied the claims purely to increase profits, and people died as a result. In my book, that is murder. Also, a mother of 3 has already been charged with threats to conduct a mass shooting or an act of terrorism after she said, delay, deny, depose, when her health insurer denied her health insurance claim. By all accounts, she has no gun or any plan, and many expect these charges won't hold up, but they're being used to set a huge bail and try to make an example out of her. Again, the real crime that was committed here was the health insurance she paid for denied her claim. The rest should be free speech unless you have much more specific threats. Meanwhile, we have corporate media and politicians who have gone into overdrive to try and turn public opinion against the shooter. The New York Times, according to Ken Klippenstein, has decided the news value and public service of showing his face is diminishing, instructing staff to dial back its use of such photos. It also directed that Luigi's manifesto not be published in the paper. And even though multiple news outlets had access to the manifesto, it was also Ken Klippenstein who first made it public. Now, I'm about to show a clip that's a bit unfair, but just to give an example of how little thought the corporate media has put into the actual problems of health insurance, this was an expert they had on to talk about this issue on ABC.
Exactly. This is the type of case I think that the society wants to see, and that the prosecutions, both on the federal side and the state side, they want to make sure that they're focused in on this. I think as far as communities are concerned, they are frustrated and they are looking at the healthcare system as a failure here in the United States. But as you said, Kira, there is absolutely no excuse for murder here. And that's exactly what happened. It was someone who shot someone in the back, and it was someone who could have done other things. Louisiana is a smart person. Mangino, he is someone who has been educated. He is someone who really could have started a swell against the healthcare company, could have started a boycott, could have gotten many people behind him. And instead, he decided to take the law in his own hands.
I choose to believe this person is smart enough to figure out why boycotting health insurance is a terrible idea, but that would suggest that she has spent no time at all considering how to fix healthcare. The reason we need the government involved is precisely because boycotts don't work for health insurance. The people who have the most bad experiences with health insurance are the very people who die without healthcare, which they can't access without insurance. And not only will they die, but they will save the insurer a ton of money if they boycott the insurance, thereby taking away their responsibility to cover the costs. There are nonviolent options. We can protest. We can do everything we can to push our politicians and support politicians like Bernie Sanders, who push for Medicare for all. Of course, these are the same so-called news outlets who did everything they could to undermine Bernie Sanders when he ran for president. Maybe if news outlets actually listened to him instead of running 16 negative articles about him in 16 hours like the Washington Post famously did in 2016, they wouldn't be making fools of themselves arguing for boycotting health insurance as the only alternative to assassinations. United Healthcare had the worst claim denial rate, double the industry average, and were accused of using an AI which drastically increased their denials. Of course, this assassination will eventually result in a new CEO with all the same incentives to be terrible, although there is one new incentive for CEOs. And for once, it is in the direction of being better to their customers. And it would not shock me if their denial rates were noticeably lower in the short term, and this assassination could easily result in hundreds of lives saved. But to save the tens of thousands who die needlessly every year, we need real reforms. The idea of health insurance is pretty straightforward, since anyone can have health problems, sometimes without warning, and when you are sick or hurt is when it's hardest to go make more money. It makes sense for people to come together, pool their money while they're healthy, and then have their health costs covered when they need them. But the US pays by far the most in the world. Here it is as a percentage of GDP. Here it is per capita. And as you can see, we pay almost double the next most. Clearly too much. Do we get what we pay for? No, not at all. The most recent World Bank rating had us at 49th best life expectancy, basically on the better end of the third world. Here we are next to OECD countries. That's South Korea that started low but passed us, and we're at the bottom for the last half of the graph. Now, the pre-Obamacare number that's widely accepted is 45,000 Americans were dying every year due to lack of health insurance. Now more people have health insurance, but the insurance has been getting worse in many ways. And you'll notice life expectancy since Obamacare came into effect hasn't really gone up at all. And then in 2020, with the pandemic, it actually went down quite a bit as the US, of course, had one of the worst responses in the world to the pandemic. So while the number dying from not having health insurance is probably down, they've managed to not actually improve life expectancy at all, suggesting insurance has managed to get enough worse to make up for the higher insured rates. This makes it a little bit harder to track the numbers because it's not as simple as just were you insured or not. Now it's, well, you were insured, but did they deny you unnecessarily? And that becomes much harder to parse out. So why doesn't it work? Isn't private enterprise supposed to be more efficient than government? It starts with for-profit health insurance. When you are for-profit, what matters is making the line, not life expectancy, but profits, go up. They have a fiduciary responsibility to make that line go up. But there were already nonprofits in the space, so the for-profit businesses had to find a way to rig the system in their favor. Copays and deductibles were perfect. They deter people from seeking care, lowering demand, and because they charge you more on the back end, they can lower upfront costs, making their plans more appealing, especially to younger, healthier people who are the most profitable to insure. And once that standard is set, all the other insurance has to follow, because you can't afford to only insure the sick. You need to make your plan appeal to the healthy to pay for the sick. But that wasn't enough. They tried to use pre-existing conditions and lifetime limits to keep out or get rid of people who might actually cost them money. Obamacare banned these practices. So now we see ever-increasing denial rates on health insurance claims. Keep in mind, every health insurance claim that's denied is an insurer overruling an actual doctor. I see a lot of people talking like insurance companies just randomly deny claims to make more money. But random is not the most efficient way to rig the game. In many cases, denying claim only leads to more expensive procedures later. So I ask, to make the line go up, who is it most efficient for health insurance companies to deny? Well, they're incentivized to get rid of anyone once they expect that person will cost them more in the future than they will receive in additional revenue from their dues. And keep in mind, expectation of future dues is reduced because people likely change insurers whenever they move or change jobs, and around 65, most will change due to Medicare. This isn't about what they want, this is about what they are incentivized to do. And they've done this before, remember pre-existing conditions and lifetime limits, which thankfully were banned, but those were just ways of approximating what they are incentivized to do. And those incentives haven't changed. Now, instead of kicking you off your policy or denying you from getting coverage to start with, they target the very same people with denials on their claims. I should be clear here. I don't think they maintain a list of who they intend not to cover. That would be an amazing way to get sued. No, it's again finding ways to approximate that. Maybe there are certain procedures which signal a person is likely to be a net loss to continue insuring. So you make it harder for those claims to be accepted. Like United Health was found to be doing with children with autism by ProPublica a week ago, where they targeted certain treatments for autism for denials, and the company said it aims to, quote, prevent new providers from joining the network and terminate existing ones who offered the treatment. And what if a CEO, such as the one who was assassinated, puts an AI in charge of such decisions? Well, I'll just say the supposed 90% error rate that the AI United Health is accused of using, I don't think it was an error. It probably just maximized making the profits go up. One of the fears for the use of AI is if given enough power and told to optimize the wrong thing, the AI may conclude humans are in the way. So let's look at how our money is spent compared to other countries. Here we see most of the increased spending goes towards inpatient and outpatient care. So it's definitely worth taking a look at the hospitals as well. We spend less on long-term care, perhaps in part due to our lower life expectancy. And preventative care is largely in line with other countries despite much higher spending overall. Prescription drug prices are noticeably higher in the US because we don't have single payer, so we can't negotiate prices like other countries, even though we also pay for most of the research that makes those drugs. Administration is also much higher because, again, we don't have single payer, so there's just crazy amounts of extra paperwork keeping track of all the different insurance companies and all their different plans. But there's another dynamic at play here that I think is worth talking about. I call it the reverse tragedy of the commons. You see, classic tragedy of the commons is the idea that when there is a shared resource, commoners may overuse and damage the resource because no one is ultimately responsible for protecting the resource, and therefore everything should be privatized. Problematic idea that has done a lot of damage, especially in health insurance, because here it's reversed. We have a group of wealthy health insurance executives controlling access, and since you may change insurance at some point in the future, they're incentivized to delay care and try to invest as little in you as possible, even if that leads to greater healthcare demands down the line, because that might be someone else's problem. So collectively, we end up spending more because they're incentivized not to deal with problems right away. Suddenly, instead of needing a minor procedure, you need a major one because you had to fight with insurance companies for too long. So what about hospitals? Well, since most of their customers are actually health insurers, they cater to them, and most provide one set of costs to insurance companies and a much higher cost to everyone else. This makes the insurance companies happy since they get to advertise absurd savings. But since the other numbers are nonsense, it just ends up inflating prices for everyone and really screwing the uninsured. We also have absurd overhead costs for hospitals managing hundreds of different insurance plans. And the entire system around how we train our doctors is a major problem. We saddle them with hundreds of thousands of dollars of debt, and then they demand appropriate pay to match that, which is fair, but it makes them incredibly expensive. So we need to look at the cost of schooling as part of this problem in order to bring down the costs of doctors. So what do we need? Single payer, government-run health insurance. Basically, Brittany was right, Medicare with some fixes for all. If everyone is on one plan, then there's no incentive to delay because it'll just cost more later. Preventative care becomes an obvious savings and therefore greatly emphasized. Making it government-run changes a ton of incentives. Suddenly, the government has much more direct incentives to encourage people to live healthier lives, to save money on healthcare because they're paying for the healthcare. This could affect things from how we build our cities to food and environmental regulations. And also, from a monetary perspective, you are worth much more to the overall economy than you will ever pay in health insurance dues. So the incentives to save people and help them live productive lives is actually much greater. The problem, of course, is politics. Trump ran on repealing Obamacare and replacing it with concepts of a plan. I don't know that he will actually succeed in repealing it this time. Republicans seem a bit less focused on that now, but regardless, for reasons I've already discussed, Obamacare was just a band-aid and it's bleeding through. So what are the barriers here? Far too many politicians have been bought by health insurance companies, and I don't see the path to Medicare for all at the moment. The only way I see anything happening without first getting money out of politics, which is a whole nother mountain we have to climb, is if enough CEOs get tired of this situation. Many are now living in fear, and our health insurance system is a drag on the rest of the economy. So why do other CEOs outside of health insurance put up with this situation? Well, they like that employer-based health insurance can give them a lot of power over their employees. It is much harder for them to strike or quit if their lives depend on keeping the insurance you provide. Also, government-run healthcare would incentivize more food and safety regulations, which certain corporations would rather not have. And we would need to actually have some adults in Congress so that we're not fearing shutdowns every few months. But those same adult politicians might be able to actually run things and might not be so easily controlled, and that's a problem. And ideologically, many of these CEOs have a hard time accepting that there's anything that shouldn't be privatized. All that said, I would suggest to CEOs that people are at a breaking point. The pitchforks appear much closer than we all thought, and it's not worth living in fear. Medicare for all is not a radical idea. It would just bring us into line with every other developed economy on Earth. There's plenty of other areas to make profit, but healthcare should be about saving lives. So all we can do is keep fighting, non-violently, for Medicare for all. And remember, it always seems impossible until it is done. Thank you for watching my video. Special thanks to Mary Kay Baum for supporting me on Patreon. And don't forget to like and subscribe, it really helps out the channel.